My name's Brandie. I'm from Alberta, Canada, and I recently just had my HSG test done this morning. I'm sharing with you my experience in hopes that it will help you, but I am going to say everybody's experience is very different. I went into this test thinking it was going to be the worst pain in my life. My doctor had told me to medicate prior to the exam, and the nurse also said it will hurt when I got to the hospital today. I did take 2 Tylenol 3s prior to my exam. I had definitely a ball of nerves with me. I was very nervous. But the doctor does explain the full test. I've heard different versions of this test from watching YouTube clips and Googling, and I'm going to give you mine. I walked into the room. I was put on a table. There was an x-ray monitor over top of my abdomen, and there was a monitor to my right so I could watch the dye being inserted. First, the doctor comes in. He inserts a speculum, which opens up the vagina. He then grabs hold of the cervix, which you might feel a bit of a pinch, and then he swabs the cervix to sterilize. A catheter is then placed inside the cervix, entering the uterus. And at that point, the doctor slowly releases the dye into the uterus. This is where most people have severe cramping and pain. I did have slight cramping, but I would say not even the worst period cramp. Just a mild pain. Tolerable, very tolerable. And as I watched the dye go into the uterus on the monitor, I could see it go into each fallopian tube, which was a big relief. To know that those tubes are open was awesome. This tests to see if the tubes are open. It also checks to see where the uterus sits and the positioning of it. My uterus definitely sits to the left, but the doctor didn't seem overly concerned about that. So, yay, the test is over. I didn't have to turn onto my side, which I've heard a lot of people saying they've had to do. I didn't have to shuffle up or down the table. I didn't have that weird catheter that has been described out there as having a balloon, where the balloon expands the cervix. I didn't have that. That sounds absolutely brutal. I'm not sure if this procedure is different from country to country, or from state to state, or province to province, or doctor to doctor. But my experience, out of a scale of 1 to 10, 10 being really brutal, I would have to say probably a 2. I hope your experience was just like mine, because it was easy. And it lasted maybe 2 minutes. I think the anxiety and the build up to the test was way worse than the exam itself. It's probably a good 4 hours now after the exam, and I'd have to say I've got some mild cramping, definitely kind of that, period cramping, but tolerable. So, good luck. I hope that helps. If you wish to leave a comment, so this way you can share your experience with other people, please go right ahead. Let them know, though, if you've had just a normal catheter or the one with the balloon, or let them know if you had black tubes, non-black tubes, if the pain was any different because of that. And let them know where you're from. I have a feeling this test is different wherever you go. Thank you for watching my video, and I hope this helps. And good luck.